All right. And for today's guest, we have our fellow brother in public health working with us today. Hailing from the University of Memphis' Master's in Public Health program to now currently working as both an environmental chemist for the city of Memphis, as well as being a research coordinator for Rose College. Y'all give it up for Mr. Chauncey Stewart. Hey,
Yes, sir. Yes, sir.
how you
How
doing,
you doing? How
brother?
you doing? Doing
Doing
great,
all
brother.
right.
Good to see you.
Yes, sir. God's plan.
God, man.
God's plan.
Hey, that's the song. That's the jam.
That's what's up.
Yes,
All right. So, Chauncey, Mr.
sir.
Chauncey, uh, God's plan. Tell us a little
hmm
bit about that. Why did you choose that as your walk-up song today?
I chose it because really, it's become one of like the biggest themes in my life. So I'm a very reflective person. So when I look back, I see moments that I didn't, that didn't make sense to me while I was living them. But now I realize that those challenges, all those experiences, the people I've met, the places I've been and seen, all of those were just in preparation for where I am today. I grew up in Memphis. I'm with a single mom, and we didn't always have a lot. I dealt with chronic health issues. There were times where we struggled to make ends meet. And when I look back to where I am now, every obstacle in my mind is what led to my current resilience. And so my story is not a story about just success, it's really a story about grace and ultimately God's plan.
Amen, man. That's what's up. And the plan's gonna
Yes, sir.
keep
Gotta,
going.
gotta have. Absolutely. Faith is a big thing to me.
Yeah, me too, man. But that's aside, man. I think it's gonna be a great conversation. Mr. Chauncey Stewart. All right, let's yeah, but let's get right into it, man. You
I
kind of
did.
warmed this up to it, but could you just tell us a little bit more about yourself and how you kind of got started on that public health journey that you were kind of hinting towards?
I got you. So I tell people all the time my journey to public health, it kind of started before I knew exactly what public health was. It's just I guess to a lot of people, public health has become like a buzzword. The pandemic kind of opened up a lot of people to it. And if you think about it, we've been steeped in it and entrenched in it our whole lives. So again, I grew up in Memphis, Tennessee, or as we call it Memphis, because it's Memphis versus everybody. Raised by a single mom, she worked incredibly hard. I'm talking about incredibly hard, supporting not only our household but a few other households on a very minimal income. And she made it work. And like many other kids growing up in underserved communities, I saw health challenges all the time. It was commonplace. I myself suffer from health challenges. I had asthma and what we later found to be a genetic blood disorder. So hospitals, doctors' offices, and medications became a very, very, very normal part of my life. But at the time, I didn't realize that those experiences were shaping exactly how I viewed the world. We kind of discount childhood a little bit, but childhood really is the foundation to a lot of our perspectives. And I didn't know exactly what I was experiencing, but I knew it was different than other people. So my neighborhood, again, we saw those same health disparities, but I knew the neighborhood across the train tracks didn't have those issues. I knew the people across the tracks, they were able to feed their family and they were able to go to a nice school and have a nice car. And I couldn't explain it, but I also those experiences made me like ask more questions. And so looking back, I feel like those became like my public health questions. So that was I kind of credit little Chauncey as the pioneer that kind of got me to where I am now. That's my beginning. But yes, sir. Then science is a big one of mine too. I fell in love with science growing up from childhood. Got older. Again, those whys popped out. Why it went from why the sky blue to a little more philosophical. Why got a
Absolutely.
little more deep. And I started to realize that science was the mechanism and the key to understanding why. And so that's why eventually I found myself to study biochemistry at the University of Memphis. Initially, I thought I wanted to be like strictly laboratory. I was gonna be that guy. Love chemistry, love biology, love mixing stuff, blowing stuff up, and
Yeah.
collecting data and evidence and all that jazz. I was Inspector Gadget. But during college, I realized that science was only the what. But even that childhood question of why was never answered. And I felt that entire communities were experiencing the same thing for across generations. It's historically documented. We have all the research, we have all the numbers, all the stats, but nobody can tell. They can tell me what it is, but they can't tell me why it is. And so that why was still buzzing. And so that's what eventually led me to public health. It honestly felt like somebody handed me like their missing piece. Like, oh my God, I had my aha. And so public health connected all those things that I cared about. It connected my love for science. It connected my experiences in medicine with doctors as a patient and I wanted to go to med school. We ain't gonna talk about it. I'm traumatized from undergrad.
Going through right now, man. Bio major.
Oh Lord,
Yeah,
and
I
I'm
know. It's
praying
like,
for you. God's plan. Let's stay
man,
strong.
we'll
Stay
see.
strong.
We'll see what
Yeah,
happens.
because it connected policy and environment and things of that nature, and most importantly, social justice. That's a big part of my life now, and that's what led me eventually to pursue my MPH in the pandemic. So, like I said, the pandemic kind of was that moment where we're stopping, we're breathing, we're on pause, and you're seeing in real time what you know to be factual, but you're seeing everybody else kind of catch up. And so I said, okay, medicine kind of is treating that one patient at a time, where public health could treat this population one population at a time. And so that's what kind of got me in here. My NPH changed the game. I highly recommend the NPH.
And that's a great journey, man. I feel like a lot of people kind of relate to that in the sense of kind of
Hmm.
starting one way with bio. I feel like that might be my journey one day, man. Like I'm a bio major right now, working in the lab, but
Yeah,
ultimately, and in a similar sense, like medicine is currently one of the big things I'm thinking about right now. But ultimately, the social justice aspect of it is my why as far as why I'm pursuing science and medicine in general. So, man, we'll see if it's in God's plan for if it's that transition to happen, man. Because I really do see the merit to the public health ability to just affect entire populations and address systemic issues, man. So that's what's up, man.
absolutely. I definitely believe in you, brother. And we need doctors. We need more black doctors. We need more, and we need holistic doctors as well. Like, and by holistic, I mean doctors with varying perspectives. So I feel like you can blend that medicine with public health with the background. You can blend those hard sciences with those softer social sciences, which is why I love public health. It's such a umbrella, if you will, and many things can fall underneath it. It's not just one thing. We kind of think about public health as being that one, you're Dr. Fauci all of a sudden, but it really comes in varying and a myriad of forms. Whatever you want to make it is that it can become that.
Feel you, man. That's facts. Uh, but I don't know. We got a little treat today, especially given the fact that it's like a two for one with you because you do environmental. You're an environmental scientist as
Hmm.
well as being a research coordinator at Rhodes University or Rhodes College. I'm sorry, but
Hmm.
I don't know. Could you just give us a breakdown of what your position is kind of like? Have you doing on a day to day basis? Like, kind of give us a walkthrough of a day of a life.
For sure, for sure. So, like I stated, my undergraduate career, biochemistry, and of course, it led me down the road to finding an internship. The city of Memphis has a great program called the Urban Fellows Program. It's for students of color, but they accept all applicants. But it's really geared to students of color who are seeking experience working in local government. And back in those times in 2017, I interviewed, and I just so happened to be placed at the our wastewater treatment facility here in Memphis, Tennessee. So we have two locations. So one is called the Maynard C. Stiles treatment facility, and one is called the T.E. Maxon treatment facility. And I got placed there serendipitously. It's not really catered to majors and stuff, but I just so happened to land the science one. So I thank God's plan. Um,
Hey,
and from there, I fell in love with the environmental aspect of science and chemistry and biology. So what a day looked for me back then, of course, as an intern, they throw everything on you they don't want to do. I was doing research. I was doing data compilations. I was doing all of that. Then the pandemic hit. I got furloughed. But again, during the pandemic, I went and got my master's. And after I graduated with my master's, they called me back and they hired me back. And so now I'm full time. That was in 2023. So it all came back full circle. Now, as a full-time employee, I have a lot more fun with environmental science. So we do again wastewater treatment. So any water that you use, whether it's in the shower, whether it's in for cooking, whether it's in the restroom, whether it's on the street, storm water as it rains, it comes to our facility. We take all the toxins out of it. We take all the environmental harms out of it, and then we reintroduce it back into the local water system. So we discharge right into the Mississippi River. But we make sure before we do that that it's free of bacteria, free of chemicals that can harm the aquatic life, whether it's flora or fauna. And so, again, it wasn't something that really was my path. Again, I was pre-med. I wanted to be a doctor. I wanted to cut you up. I wanted to be a surgeon. Grey's Anatomy really had me in a chokehold. But I did come to love environmental science. And so now we do wastewater epidemiology. So I was able to marry that laboratory science background with public health. And so we take those wastewater samples and we analyze them for COVID-19. We analyze them for norovirus and other infectious diseases. And it's a very cool experience. I do microscopy a lot where I look at samples under the microscope to make sure that samples don't contain harmful organisms. If they do, I can classify them and recommend different treatments to help kill them, sterilize the water, or as best we can, and then discharge it again. So my day varies a lot. As a research coordinator at Rose College, that came later in my journey at the city of Memphis. That came last year. So I've been about a year and a half now. And that was a study. I was asked to be a part of a study seeking to understand the impact cultural consciousness had on nursing. So the NFP, or the Nurse Family Partnership, is a great organization by the organization Changing. It's a program for first-time mothers who are in need of care. They're low income usually, underinsured usually, and these nurses go to the homes of these first-time moms, give them care, give them treatment, give them resources. And I thought that was the coolest thing. I said, sign me up expeditiously. And so from there, I led a bunch of interviews. I trained undergraduate students on how to go about those interviews, and then we ended up developing a white paper and a framework for cultural consciousness to be used in other program evaluations. So those are some cool things. And again, it just goes to show like the marrying that can happen within public health. That you don't have to just be one thing. And now, through that roles opportunity, I have garnered the opportunity to become an adjunct faculty member. So I'll be teaching in the fall environmental justice and public health. So it all came together.
Man, opportunities keep coming. Doors are gonna open, man. I love to hear
Absolutely.
that.
And I joke all the time that a day in my life never looks the same twice. I never live the same day twice. It's always something. So I'm a chemist by day, a student, educator, researcher by night. It's been a whirlwind. I'm tired.
Hey,
Thanks.
hey, that's why you gotta have your days off, man. You gotta enjoy them off,
Absolutely.
man. But I
Got
appreciate
to.
you taking time with me to honor your day out, though. I appreciate
Oh, no,
that.
this is a joy.
Hey, I hope it is, man. Because we're honored to have you, man. But that sounds awesome, man. I really like how, like, kind of like what you said, how diverse and how many
Mhm.
different things you can do with that public health, that master's of public health, man. That sounds like living the dream right now, man.
For sure, for sure. Again, it's what you make it. It's if you decide you want to do one thing, to as long as it doesn't interfere with anything, as long as it doesn't impact you health wise, because
Mm.
rest is important. Rest, but if you want to do it, do it. Go out and get it.
How do you guys give treatment to the water? Like, what kind of things do you do to the water to sterilize it or get the bacteria out? That's interesting to me.
So initially, we started with chlorine. So we was using chlorine for a while. That's the industry standard. It's cheap. It's effective. Everybody has bleach.
Yeah.
um, when I was an intern, I was charged with finding like an alternative to that because, as you know, especially in higher doses, chlorine is a little tricky when it comes to the half life. So it usually stays in aqueous solutions or water based solutions a little bit longer than we would like. In high concentrations. So they would have a bunch of issues with finding minute traces of it out in the river. Big no, federally. You know, the feds coming. They will charge you. We get audited very, very, very frequently, and they will charge you if they find something in violation. And so their research I did landed us to use peracetic acid, which is kind of like a vinegar type solution. And it's been great ever since. They've been doing it, I think, for the last 6 years. And it's been great. We use it. It has like a 99% effective rate. And that's how we do it. So as the water comes into the system, it goes through several stages of treatment. It goes through settling, get all the chunky bits out. It goes through the biological phase where the bacteria uses up all the carbon and all of the stuff that makes it a little funky in there.
Yeah.
You know, and then after that phase, we have to then kill that bacteria. You know, they've done their job. We thank them. We have to, get their population down so we can safely dish out the river. So we use a few different systems, physical, chemistry, and like just chemicals to do it. So it's a multi stage system.
That's
It's very
awesome.
interesting. Again, I would have never chose that for myself, but it came about, and I loved it. I fell in love later.
Yeah, man. I feel like I don't. Right now, I work in the hospital on the weekends as I'm like a lab assistant to like the hospital lab environment. It sounds a little bit similar, like in the sense that it's like behind the scenes kind of work that's affecting
Mhm.
everyone. Like they do the tests on the blood samples and the urine samples and just everything, man. But all those, all the lab, shout out to all the lab techs back there, out there in the field, working in the hospitals, working the water treatment plants. So just all that behind
Absolutely.
the scenes work affects everyone, man. So just shout out to
Look,
you and
shout out
all
to
the
us,
people. Yeah,
right?
y'all don't get your flowers enough.
Yeah, that was perfect. What you said is definitely a background type of job. These are positions, whether it's in a hospital, whether it's in environmental sectors. These are jobs that nobody really considers, right? That nobody really like. Oh, I just get my results from the doctor, or oh, I just use my sink. I just use my toilet. I just wash my car, and don't think about the next step of that. That somebody is responsible for then making sure that those issues are handled. Somebody has to take care of those things.
Yeah, nah, I feel you, man. Shout out I gotta give you your flowers, man. That's what's up.
You too, likewise.
And then so we got to rep brothers in public health. We are brothers in public health, black men in the field. So my
And
question to you is like, how has being a black man in the public health industry shaped your experience thus far? Going through school, working in the industry, how's it
yeah,
influenced you?
it's done quite a bit. So again, as a black man, uh, we're already such a marginalized group. Just being black, you are the subject of a bunch of these disparities, and so it really has become an eye-opening experience, and it deepens the work. It makes it more personal because these are no longer statistics. These are no longer data points. These are no longer GIS maps. This is your neighborhood. This is your community. This is your brother. This is your sister, your mom. You have real interactions with these individuals every day, and you see the outcomes that they experience every day, and that you yourself experience every day. And that adds a layer to that on that regard. And then also, just being a black man in public health representation. That me growing up from an underserved community, I didn't see a black man who was an environmental chemist. I didn't see a black man who not only had a master's period, but had an MPH. Or I didn't see a black man pursuing a doctoral degree. And so I had to become those things to be a representation to my community. That is somebody from these trenches that we call them can do it. That there is more than one. Like we say, public health is a multifaceted career choice. That life in general is multifaceted. That you don't have to succumb to that one lane. You can do whatever you set your mind to. But my mom used to tell me all the time that if you tell me I know it, but if you show me I can be it. And I love as a black man that I have become the showing part of that I can show the youth that there's another way, there's another alternative.
Yes, sir. Man, I like that. That's why we're doing this podcast, man. We gotta reach the youth, show them what's up with public health stuff. There's something to
For
it, man.
sure.
Y'all out there,
It's an
y'all can.
underrated career. Like nobody
Yeah.
talks about it a lot. Again, we had to like oopsie daisy onto it. In the pandemic, we were in the house all day, so we didn't have any choice but to research and look up stuff. But
Yeah.
yeah, it's definitely underrated, and we need more men of color in it, and really, really anybody of color, because who better to serve us than us? You know, who better to tell someone about disparities than someone who lived those same disparities? You know, partially overcome those disparities because we can only go so far. you know.
Man, but I don't want to get into a somber tone, but uh, what kind of uh, we like to be authentic on this podcast. So if you could open up about any potential challenges that you've had on your journey
For
to
sure.
this point.
Yes, sir. Yes, sir. My favorite Langston Hughes poem is "Life is not a crystal stair." It's never a linear situation. It's never straight up and down. It's always going to be some curves and turns in there. A big one to me was imposter syndrome. So again, I feel imposter syndrome. I kind of battle with it. It's not. I'm like, oh, it's not a real thing. It's just to keep us down. But also, you can suffer. I suffer from it a little bit because you end up in rooms in which, like, oh, am I supposed to be there? Like, oh, y'all believe in me a little bit too much. Y'all expect me to know just a little bit too much, and that's probably been my biggest thing to overcome. Um, Also, just balance has been a big challenge over the last few years of just balancing social obligations, balancing financially, because I'm in school, I'm working, and I'm just you throwing money everywhere. But then also just balancing the work life as well, like all these different places of employment. I have to keep up with them, keep up with projects, keep up with deadlines, keep up with people. Because I work with students a lot and just trying to keep my ducks in a row. So those are my biggest challenges in my personal life, and then this is also what inspired me too to pursue public health. Due to my health challenges, I have experienced medical racism before, and that kind of changed my brain chemistry too, which made me kind of leave my desire to pursue medicine in the dust, really, because I saw how harmful, in that regard, how harmful medicine is to our people. And yeah, so that has been a big challenge, and of course, just general racism of being the only black guy in the room. Kind of intimidated or not taking it seriously as you probably would have been if came from anybody else. So that was a bit my things. But again, for every person that's against you, you have 10 people that's for you. That's cheering for you, that root for you. I try to keep it as positive as possible. You can't help what other people think about you. Only thing that matters is what you say about you.
Yeah, all y'all brothers out there listening, y'all not alone, man. We're out here
hmm
going through it too, but we're all here together. So no, you're not alone out there.
On the front lines.
Yes, sir. But let's change back the energy up to some more positivity. What is
Yes.
like your favorite all time public health moment or memory that you've ever had in the field or at school, anything like that?
Favorite all time. That's a great question. Favorite all time public health memory. Um, I feel like my favorite and most like life changing memory was in my master's program. That's when I went to my first APHA conference, and that's when I got my first publication. It felt amazing. So during my NPH, I worked with the local health department here in the Shelby County Health Department, and at the time we were studying like vaccine hesitancy among Black individuals in Memphis, specifically in the lowest income zip codes in Memphis, and we identified 9 of them out of the 13, which is crazy. The 9 out of 13 in low income is insane to me. But during that study, we found that a big part of that messaging campaign that it missed like medical mistrust. That people didn't just believe in the vaccination, they didn't believe in the institution of medicine, they didn't believe that the government had their best interests at heart, and that kind of was just so eye opening to experience number one. And again, number two, I was able to get that message out to something as refutable as unreputable as the APHA, and talk about it, talk to stakeholders about it, and do presentations for it. That was amazing. And then, of course, just being I can say I'm a published author, that street cred, that academic street cred,
I know,
helped
man.
a lot. So when I got that call, that probably was like the best moment of my life.
Hey, congratulations, man. Y'all clap it up for
Thank you,
Mr.
thank you.
Chauncey, man. That's what's up. Man, I can only imagine, man, working in the government
Mm-hmm.
and trying to represent, like, that's such a sensitive topic for our community because
It
there's a lot
is.
of the government, medicine in general, the medical community in general, there's a lot of reasons for them to not have trust in what they're trying to push on to the community. So shout out to you for doing the work, man, getting it out in the field. I appreciate. We need it in our community. That's why they need brothers representing, and they need us
Absolutely.
in those rooms, kind of making sure that it's for their best interest. That we're not kind of letting them just abuse our communities, man. That's what's up.
For sure. That's actually what inspired my dissertation topic as well. That I'm trying to focus and hone in again on the medical mistrust and how it correlates to different communicable diseases and different other like cardiovascular disease and other non-communicable diseases as well. How we navigate those and manage those because that's a big issue. I want to kind of show the institutions like per disease this is how we're affected. And I feel like it's just such a, it's disheartening, but such a hopeful thing because hopefully our fights and our effort, you pray that your efforts don't go, and fall on deaf ears. You pray that what you're doing results in significant and meaningful change for your people.
Yeah, man. I know it's in God's plan. It's gonna work out, man. No matter, like, that's that.
Perfect
Keep coming
song.
back to that song, man. That's a great song. Yeah, that's what's up.
Perfect
All right,
song.
all right. Uh, yeah, Chauncey, do you have? I'm still in the field. I'm still a student. You work with lots of students, so maybe this will be easier for you. But could you break down one public health concept that everyone needs to know? I'm still learning a lot about public health. I got a lot to learn. You're expert, so
Oh yeah.
you want to break
I
something
was in
down? I mean,
this.
that's
Look,
the
no,
publications.
we learn it. We learn it together. But I definitely can answer that question. So I know we're as public health champions. I know we're all familiar with the social determinants of health. I feel like you get hit over the head with it. And for those who don't know, social determinants of health are basically, as the World Health Organization classifies them as the places we live, work, age, and play, and how those affect our health outcomes and just generally our well-being as a whole. They include like school systems and socioeconomic status, all that jazz. But what people don't usually talk about is what I've just recently learned in my doctoral program is the political determinants of health. So the political determinants of health are the legal drivers that inform the social determinants of health because it's the why. The social determinants of health tell us the what, but my ache is the why. So and the political determinants of health really gave me a great foundation as to that why. So those are the legal, those are the political, the policy decisions that are made, that have been made well before us, well before our grandparents. These are hundreds of years old policies that still impact the way in which that our lives are determined and the way we live our lives in 2026. And I feel like that is just so important to understand as a public health champion as well. A great example to me is redlining. Redlining was the governmental practice back in the 30s where they determined black neighborhoods to be poorer neighborhoods or like undesirable neighborhoods, while your more affluent white neighborhoods where your prime real estate and those were like valuable communities. And so with those classifications and those characterizations, those they allocated resources to those areas. So the more affluent areas, they got grocery stores, they got, swimming pools and recreational areas. They got better schools and better governmental assistance. Meanwhile, your poor areas, they had to fight and scrounge for themselves. The grocery stores are far few in between. Many of them had to commute to other areas to find food. We call those food deserts.
Yeah.
All that. And if you were to look at a map of your city from the a redlining map of your city from the 30s, and look at that same map and kind of trace like food insecurity, socioeconomic status, crime. If you were to trace all of those indicators in 2026, you will usually find that they are identical still, 90 years later.
Yeah.
That those same decisions that were made again of no fault of your own, no fault of that community, no fault of not even no fault of the affluent community. It was the decisions made way decades in advance, and you're still feeling those effects. And I feel like that's more so profound to think about. It's a little bit enraging. I've been mad.
Yeah,
I've been
man.
mad. The more you get a little upset. But it's just such an eye-opening thing to learn about. That again, we hear the social determinants of health a bunch, but we never hear like why those are a thing.
Exactly, man. We gotta clip this and post it as like a little short reel or something, man. Because that's everyone. A lot of people need to hear that, man.
For
The
sure.
because especially in public health, it's easy for people to look at data or anything and blame it on the social determinants of health, kind of
Hmm.
blame the victim in a sense. When in reality, so much of this is a systemic issue that, like you said, based on choices that none of us were here to even make, man. It all ties
Hmm.
back to the system that a
Yes.
lot of us might be working in. So we got to work towards addressing the political determinants versus just batting the victim over the head. And so,
Yeah. For sure. And what's crazy is the people that made those decisions, they probably passed away shortly after they made the decision too. And they weren't even there to see. It's just it's crazy.
yeah, man.
Redlining probably I use that as a example for all my classes, all my students, because it's just such I pull up a map, and you literally can see it. And again, if you tell me I know it, if you show me I can be it. Like literally, you can see it bar for bar, and each decade it's the same. No improvement, no growth. Every now and again, as neighborhoods and gentrification happens. But yeah, it's a political determinants of health was a big eye opener.
All y'all public health workers better have been listening during that part, man. Y'all had your listening ears on, But
And I feel like it's ever the more relevant, especially now. We live in such a tumultuous social political climate now. It's like, oh my God, and I fear for like the repercussions that we are to face like decades later. Because you usually don't see the effects of a presidency until the next one. And so I don't know what that will look like and how much fixing the country will need, after this one.
but that's why we out here out here in the
Right.
field getting that work done, trying to represent, man. We
Mr.
gotta.
Scott, we need you. Come on now.
That's what's up. That's why we out here, man. That's what we're doing this all for our
Yes, sir.
people, man. All right, let's get into a little bit of the fun part. We're locked in.
Hmm.
We're making change in our community, but let's get into the little fun part. Let's lighten the mood a little bit in a sense. But so I'm just gonna ask a bunch of kind of rapid fire questions. You can
Okay.
ask. I mean, I'm gonna ask them, and some of them will be like this or that kind of style. Would you rather kind of
Mhm.
style? So it should be a little bit more fun part of the segment. So
I
you ready,
got you.
Chauncey?
We down. I'm down for fun.
Hey, let's go. All right. So my first question for you is: if you could pick one superpower to help you out at work, and I mean, you already are a superhero in a sense, man. You got the two jobs going on. You out here in the lab, the students. You are a superhero already. But if you had the ability to pick one more superpower to help you out at work, what would it be and why?
I would love the ability to clone myself. I get
I,
so much done. I get so much done.
nah, man.
I had one chance there, one chance here, and I'll be the main one sleep in the back.
Yeah, that's, yo,
But
that's
yeah,
funny.
I'm one of those people. I have to like. I want to do it all. I feel like one lifetime is not long enough. You know, I want to experience and learn as much as I can. I want to help as many people as I can, and I just feel like cloning myself. I could do it.
Oh man, I feel you, man. It's just,
Well, what was yours? What would you choose?
that sounds good to me too. I got the podcast going on. I'm
Hmm.
researching this summer at UMass Boston, doing bio research, working at a
See,
hospital. Man, if I could just have all of them go out and just give me the money, give me the knowledge, give me the experience. I don't know, just represent for me. That clone sounds pretty good to me too. I'm like that same type of
it's
like man.
underrated. I
It's a good
need
choice.
clones, and
Yes, sir.
you sound like a superhero too, doing
Hey,
level things.
trying to get up there, man, but I'm trying to get like you though. Come on now. All right, my next question for you is: would you rather present like a big, complex data brief, like a
Mhm.
publication or some sort of data, to a room of hostile and just
Mhm.
skeptical politicians, or would you rather have to explain like a complex work-related statistic to a bunch of like crazy middle schoolers, not really paying attention, joking around, like politicians or crazy middle schoolers? Just
You gotta give me the middle schoolers. I don't have the patience for like hostility, you know what I'm saying? So you gotta give me the middle schoolers. And I feel like if you can explain it, if you know it well enough, then that goes for any topic. If you know it well enough, you can explain it to anybody. You can explain it on any level. So definitely give me the kids. I actually had an experience with that recently. So a lot of for my job, sometimes I go and speak at schools, at elementary schools, about like what I do in the lab, and definitely it's a challenge. You have to wrangle them in. That attention span is 2 seconds.
yeah,
You know, it's giving goldfish, but you gotta wrangle them. But once you wrangle them in, I had to bribe them. You know, I had little snacks and stuff.
yeah,
They're great, but
yeah.
the adults you can't wrangle them
Oh, yeah,
in.
yeah, man. They're
Their
too
mind is
far
already
gone.
made. Yeah, the mind is already made up.
Yeah, that's bad. That's a bad answer, man. And that's what's up, man. I like to hear that working out, teaching the kids what's up, man. Because you said you didn't see too many environmental scientists out there, so that I'm glad. That's what we need more of
Exactly.
that out here, man. That's awesome.
This is what we're about. We're raising the next generation.
Yes, sir. All right. Would you rather discover a brand new, highly toxic endocrine disruptor in the water? Like I don't know,
Mm,
be the first to find like something crazy, like be the first one
yeah,
to find it, or like invent a chemical that degrades all microplastics in the water.
definitely microplastics. Gotta do the micro. I think my boss will get on me if I don't do the microplastics. That's part of what we study. We look for too. We send they call PFAAs or polyfluoroalkyl alkali substances, and basically they're forever plastics. You know, forever chemicals, but they sequester different materials and plastics and stuff. So yes, that's a big issue. And again, the federal government. One thing about it, the EPA is very strict. TDEC, the Tennessee Department of Environmental Conservation, very strict. And I feel like the less pollutants they have to deal with, the better. So I
Yeah,
definitely destroy all the microplastics. We can do it today. And also just that help to me that help create more drinkable water. I feel like we don't realize how finite water is as a resource, the fresh water. Mm.
yeah. I wanna. Yeah, that's. I hear about it. Like I should honestly do more research into it, but I hear people talking about how like there's already microplastics in our body right now as we're speaking. Like
Mhm.
it's crazy,
Yes,
man.
you're gonna learn later bioaccumulation. So yeah, we've been ingesting them little by little, and they'll build up over our lifetime. You know.
Yikes, man.
And
Yeah,
speaking of water being finite, a lot of cities, and I think Boston is one of them, they recycle water. So they go from wastewater to clean water. Memphis is blessed to have a two tier system. So we have a wastewater system, and we have like a naturally occurring aquifer, which we get fresh water from. You know, so
Okay
it's a
then, man.
finite. It's only a few million gallons
Oh
left.
man, no shoot.
A few
Oh
100 million gallons.
yeah, yeah. I'll talk to my people. I'll get them to send some water down over Memphis when the time comes. You know.
Send them in. Send them in.
Yeah. All right. My next question is, if you had any like nice public health books to recommend, as I learn more about public health, so it's nice to have a little good books. So if you have any recommendations, I'd appreciate that.
For sure, they're all behind me. But my main one is The Color of Law. I hope it's not flipped, but it looks like this: The Color of Law by Richard Rothstein. It kind of goes into greater detail the political determinants of health, redlining, and a new area of study that I'm interested in legal epidemiology. It kind of breaks down how, again, different laws impact and shape health outcomes, and it shows you that correlation. It's a great read. A very challenging read again because you would think in 2026 we will be beyond a bunch of some of these, at least a good portion of discriminatory practices of like blatant disparity. About blatant systemic inequity, but we're still there. Unfortunately, we just changed decade. We changed time periods, but the game is still the same. Another one is the political determinants of health by my professor, by my dean of my school. I go to Meharry Medical College, and he's written directly outlining the political determinants of health. Again, I'm a champion of it. Once I learned about it, I became like a hotep. Like you can't. I'm on the streets. I'm singing it the song out loud because it's just such a mind blowing thing to have come into, and it sounds so like matter of fact. It sounds so like rudimentary, like oh, you should have been on that, but you really don't conceptualize it in that regard. Like oh, people make laws and we have presidents and we have Congress, but you just never like oh that particular law, like oh Roe v. Wade increased the health outcomes of women. Like you just never
Yeah.
put that together. At least I didn't. And so those are my biggest two recommendations. A fun read is Black AF History. I love it. I'm almost done with it, but it's African American history is great.
Mm.
10 out of 10.
Man, that's awesome, man. I got some reading to do this summer, man. I'm gonna be locked in all
I'm
summer
trying to
long.
get more well read. I've been on TikTok too much lately, and my algorithm is spitting out to me like the literary crisis. And I said, is my for you page trying to tell me something?
Yeah.
Am I part of the literary crisis? And so I said, let me
Literary.
start reading more. You know, so I'm trying to work through them.
Yeah, man. I feel like maybe it's just undergrad, right? Maybe it's just we busy all the time, man. Out here doing work in the doing work, but man, but it's always good to take some time to read, man. I feel like I gotta get back into that habit more often, man.
For
I might
sure.
be part of that literacy crisis too, man. If it's not like
It's
if it
something
ain't the
about it.
yeah, if it
Yeah,
ain't the Bible, if it ain't the textbook from school or
hey
something,
man.
man, it's kind of hard to get into it. But I appreciate the recommendation.
For sure, for sure. I feel like school ruined. I think undergrad ruined reading for me when it became a requirement.
Yeah,
I used to just read for fun, but now I
it's
have
gonna
to
take
like make myself read.
and be like that, man.
Read,
I
read your
gotta,
books, kids.
yeah, I gotta, I gotta push through it, man. You said read.
See, read your books, kids. Mr.
Yeah.
Rogers did not fight for nothing. Read. Reading Rainbow did not exist for nothing. Please read.
Hey. Yeah, that's crazy. All right, but I don't know. This is gonna be you kind of answered my last question with the Mr. Rogers lecture, but do you have any last kind of pieces of advice for any young brother out there considering pursuing public health or going through it right now? Any final
My,
piece of advice?
yes, sir. My best piece of advice: stay true to yourself. Keep whatever your faith system is, whatever you call it. It could be God. It could be Allah. It could be yourself. It could be your friends, family. keep those important aspects of yourself centered and grounded, and also just lead with your community in mind. Just try to be better or make us better tomorrow than we were today. And that's my thing. Keep grinding. It's a marathon.
Words, man. It's a marathon, not a sprint. It's not gonna finish
Amen.
overnight, but we're gonna get it done no matter what.
The same way we have been harmed over time. We can also change our outcomes and our outlooks over time too. You know, we ain't gonna sit down and take it.
We fighters out here. We riding.
Amen.
All right, but that was my last question for you. But I just want to say thank you again, Chauncey. It was a pleasure,
Sure.
and I just want to uh, give you the chance to shout out any like platforms you're on or anything that you might want to plug on the podcast as far
For
as
sure,
like
for sure.
yeah.
Thank you so much for having me again, Nathan. I loved it. You guys can hit me up on Instagram. I don't use it a lot. Facebook, all that jazz. Same handle. Chauncey Chauncey .Stewart. And I should be on there. LinkedIn, the same deal. Chauncey D Stewart. NPH. But yeah, those are my only forms of social media. I'm an old man.
Hey, yeah, you can take what you get though. That's what's
Right.
up. But yeah, just thank you so much, Shaz. That was awesome. It's just great to learn, especially from a professional point of view, man. Doing all this field work, man, stuff in the lab, working with the youth, working with the students. It's just very inspirational, man. I
Like,
feel I talked to a lot to people on the podcast, but I feel especially inspired by your journey, man. I hope to impact be the Chauncey Stewart of Boston one day.
that means the world to me. I don't, I try to be that light, and I try to be a big of an inspiration as I can, but I'm also blown away by you. Thank you so much for platforming other black people in public health, black men. Again, this podcast is a necessity,
Yes, sir.
to kind of garner young minds and get people's wheels turning about what we do every day. Because again, like you said so beautifully earlier, unsung heroes. People don't really realize how much goes into living every day. We just we take it for granted, but there are people behind the scenes that are actually responsible for a lot of the things that we enjoy.
We gotta give you, and that's what we gotta do. We gotta give uh behind the scenes workers their flowers, but just black men their flowers too. Man, a lot of black men don't get their flowers till they in the grave, man. So gotta give you your
Man,
flowers while you're still here.
for
So
sure, for sure.
yes, sir. And I just want to thank everyone.
I think next segment, bring me
Yeah,
back.
yeah, yes, sir.
I'm
Yeah,
coming
I,
back.
I just want to thank everyone else in the audience, all my brothers and sisters in the audience for making it to the end. If you did, like and subscribe to stay tuned for more episode and give us a follow on LinkedIn, Instagram at Brothers in Public Health. And if you're interested in joining the network or supporting the work being done by Brothers in Public Health, check out the website brosinpublichealth.org to donate or become a member if you're interested. But with that being said, just thank you again, Chauncey, and thank you all again, and peace out.
Thank y'all for having me.
Yes, sir.